Hello, I'm Dr. Michael Detoli. Here at the Detoli Cancer Center and Brachytherapy Research Institute, our commitment is focused specifically on prostate cancer. That's all we do here. This singular purpose has enabled us to assemble and train an exceptional team of professionals, acquire and master state-of-the-art tools, and establish an international reputation in our field. My colleague and partner, Dr. Richard Surace, is going to show you how we develop your individual treatment plan.
By the time we meet most of our patients, they've already had an initial diagnosis, so our process begins with additional lab work and more definitive diagnostic exams. Day one with Team Detoli begins with our advanced 3D color flow Doppler ultrasound. Chris Wells is our ultrasound technician, and he's going to explain this procedure for you.
Using the color flow Doppler ultrasound, we are able to easily identify the blood-rich color flow areas of the tumor, which easily allows us to do the implant at the hospital. While doing the seed implant, we will be using the color flow Doppler ultrasound to help us pinpoint exact areas in your prostate that match your plan.
The second major diagnostic tool is a helical CT scan. Jennifer, our chief technologist, will explain how it works and what we'll learn.
The helical CT scanner gives us three-dimensional views of the soft tissue. This helps us to precisely locate the prostate and the surrounding structures. These scans will be reviewed by the physician and a treatment strategy will be mapped out.
These scans will then be reviewed by Dr. Detoli or myself, and the basis for your individual treatment strategy will be mapped out. Diagnostics complete, we'll now go to the dosimetry suite where the treatment plan will be developed. Joan, one of our certified medical dosimetrists, demonstrates the inverse planning process.
For your IMRT plan, we will use the information that was taken during your initial CT scan. The doctors have drawn on the structures on the CT scan that will be critical during your planning. From there, everything is shipped over to our computers here in dosimetry and we're able to begin your plan. We're able to see critical structures in the three-dimensional image of your body that we're able to render from your CT scan. And those structures we can see are the bladder, which is in yellow, the prostate, which is in blue, the seminal vesicles, which are in green, and the rectum, which is in red. These structures are all important in your scan in that some of the structures we want to limit dose to, such as the bladder and the rectum, and other structures, such as the prostate and seminal vesicles, we want to make sure get adequate dose. Once we've identified the structures in the three-dimensional view, we're able to place the beams onto your CT scan so that we can see exactly the position of the machine, how it'll deliver the dose, and what the dose looks like in your body. For your particular treatment, we're going to place on 7 fields. We start with a field from the top, from the right side, from the right back side, and the left side, back, front, and side. Once we've placed the beams on, then the computer will do its thing and it'll produce what we call isodose lines. These lines tell us exactly what the dose will look like as it goes through your body, and we can identify any spots that are hot or cold and customize the treatment to you so that everything is nice and uniform. The dose cloud is adequately covering the prostate area, and you can see that it actually misses, there's a space here between the prostate cloud, the dose cloud, and the penile bulb, which shows us that there's little to no dose going to the penile bulb. We can also see that if I turn the prostate off, you can see that the tumor areas are well within the dose cloud, and also the urethra is spared. You can see the hole going right through the middle there where there's no or little dose going, and that's exactly where the urethra is. So we're sparing the urethra and we're sparing the penile tissue. Once the plan has been completed in the treatment planning computer, then we can check the parameters of your treatment before it goes to the treatment machine. And one of those parameters is the leaves, the multi-leaf collimator that actually shapes the beam as it's giving you the treatment. And we can watch the leaves move on our treatment planning computer as they would on the machine during treatment. You can see the leaves moving across the screen, and now as they're closing, they'll finish off the treatment. That completes the treatment in this treatment planning computer. We then send everything to validation. During the validation, we want to make sure that everything is correct, So we use a separate computer program, a separate software program that's able to look at your treatment and validate that everything is correct. From there, it is sent over to the treatment unit and you're ready to begin your radiation therapy.
Intensity modulated radiation therapy treatments using this uniquely formulated plan will usually begin within 3 or 4 days after the initial diagnostic exams. Our standard protocol is 4 to 4.5 weeks of daily radiation treatments. Each plan is actually developed as 3 cycles. The second and third cycles are coned down to focus the radiation beamlets more tightly on the prescribed area. If your treatment calls for brachytherapy, seed implantation, our team of medical dosimetrists and physicists will create a 3-dimensional map for the placement of your seeds.
What I do is I take the ultrasound images that Chris has done on you prior, and Dr. Dottoli will designate what's your prostate and what's the prostate, plus usually a margin of tissue around it that he also wants to treat. At that point, we take it over here to the computer system. This is the area that's the closest to the bladder. The red is the prostate, the red line, and then the blue is the prostate plus a margin of tissue that Dr. Dottoli wants also included. And we go slice by slice. We're just moving back through it, and we're just entering everything in. At that point, what we do is we're going to go ahead and put the radioactive materials in. And what we do is we look at it, and we've got the MRIs, the CTs, the ultrasounds, what have you, and we know where the cancer is. And what we're doing is we're just focusing on that, and we're putting our radioactive materials right in that tissue, and we're just moving a slice at a time through it, and we're just getting an optimal plan to treat you individually with. At that point, what we do is we're going to review it. We're going to look at it in a 2-dimension. We can actually move through the prostate. Right now we're moving from the anterior tissues back through it, through the posterior. We're looking at it in all areas, making sure there's no hot spots, everything is good to go. And then we'll look at it in a 3-dimensional. Note the seeds are specifically loaded in a peripheral pattern with seeds placed in extra capsular location as needed to minimize urethral doses and maximize tumor dosage. Each one of these markers is a needle that we're going to place in your prostate. These are the actual sources that are being loaded into them. Each one has a designated position. Once we have that, it's reviewed by Dr. Dottoli, and we go ahead and we order your radioactive materials. They're ordered out of Georgia. They come in next day air into Sarasota Memorial Hospital. At that point, I pick them up, calibrate them, and I bring them to OR, and I get them sterilized and ready for your procedure the next day.
The day after seed implantation, the patient will return to our office for another helical CT scan to confirm placement and count of the seeds, as well as to calculate the dosimetric dispersion of the palladium over a 3-month period. At this point, we'll often determine through physics calculations that the patient may benefit from additional IMRT radiation to the periprostatic tissues. If indicated, supplemental treatment plan for 3 to 8 additional treatments will then be developed. The post-implant IMRT treatments will be scheduled at the time of your first appointment, 3 months after your seeding. The Palladium-103 seeds we use have a very short half-life of only 17 days. That means their strength is diminished by half every 17 days. The impact of the seeds begins to peak at 3 weeks and usually subsides significantly by 3 months. Follow-up appointments are scheduled at 3 to 6 months and at 1 year to confirm and track progress. By the second follow-up visit, the vast majority of our patients have returned to normal lives without significant side effects.
Thank you. We hope this video will help you understand the complexity and precision of our diagnostic and treatment protocols. If you have any questions, please feel free to ask any member of Team Dottoli.